Come in.
Hi, my name is Jennifer. I'm a student nurse at OSUIT. I'm going to be performing your physical assessment today. Can you tell me your name and date of birth?
Beth Turner, 8/16/73.
Okay, very good. The nurse tech already took your vitals, so we're going to go ahead with your physical assessment. First, I'm going to wash my hands. Okay, I'm going to start with the palpating your scalp. We're going to check for any lesions, abnormalities, lumps, or infestations. Okay, good. Everything looks good. Next, I'm going to palpate your maxillary and frontal sinuses. You tell me if you have any pain or tenderness.
No.
Okay. Next, we're going to examine your eyes. I'm going to check your pupils. Very good. Your pupils are equal, round, and react to light. I'm going to have you look at my pen. We're going to check for accommodation. Look at my pen and then look at the wall. Okay, very good. Your eyes are bilaterally symmetric. Next, I'm going to examine your nose. Checking for a deviated septum. Your mucous membranes are pink and moist. Next, we're going to check for patency. I'm going to have you sniff. Very good. Sniff. Okay, flare out your nostrils. Very good. Your nose is symmetric. Next, we're going to examine your mouth. I'm going to have you stick out your tongue and say, ah. Very good. Your uvula is not deviated. Your hard palate is free of any sores or lesions. Your mucous membranes are pink and moist. Your tongue is free of any sores or lesions. Your teeth are white and in line. Your soft palate is free of any sores and lesions. Your lips are pink and moist. Okay, next we're going to examine your ears. You tell me if you have any pain or tenderness.
No.
Okay. Okay, I'm palpating the auricles. Next I'm going to press on your tragus. Tell me if you have any pain or tenderness.
No.
Very good. Okay, next we're going to examine your neck. Your trachea is midline and center. I'm going to palpate the thyroid gland. Tell me if you have any pain or tenderness.
No.
Okay, it has no lumps or abnormalities. Next, I'm going to feel your carotid pulse one at a time. Okay. Next, I'm going to auscultate your carotid. I'm going to be checking for a carotid bruit, which would indicate narrowing of a vessel. I'm going to do so with the bell of my stethoscope. Okay, sounds good. Next, I'm going to check your skin, inspect and palpate your skin for any inconsistencies, and check your temperature. Okay, good. Your skin is warm and your color is consistent with the rest of your body. Next, I'm going to auscultate your lungs. Okay. Have you breathe in and out for me? 1, 2, 3, 4, 5, 6, 7, 8. Okay, I didn't see any use of accessory muscles and your excursion was symmetric. And I didn't hear any adventitious sounds. Okay, next we're going to auscultate and listen to your heart. Okay, I'm going to start left at the at your pulmonic valve, which is right at the sternum, and the second intercostal space. And then the pulmonic valve is in your second intercostal space left of the sternum. Next is your Erb's point, which is in your third intercostal space. Next is your tricuspid valve, which is in your fourth intercostal space. Next is your mitral valve, which is in your fifth intercostal space, which is also where your apical pulse is located, and it's your point of maximal impulse. Okay, and I didn't hear any dysrhythmias. And I'm going to feel for any pulsations. Okay, no. Okay, do you perform a monthly breast exam?
No.
Okay, every month, on the same day of every month, you need to perform a monthly breast exam. I'm going to show you how to do it. Place your hand behind your head. Okay, start in your armpit and move in a clockwise motion around your nipple. Okay, whenever you get to the nipple, you need to squeeze, see if there's any discharge. If you have any pain or tenderness or any abnormalities, you need to contact your physician and schedule an appointment. Okay. Let's see. Okay, now we're gonna check your upper extremities. I'm gonna check for any edema, lesions, skin inconsistency. I'm gonna check your temperature. Okay. Next, I'm gonna check your capillary refill. Okay, good. It blanches within 3 seconds. Next, I'm gonna check your pulses. Okay, this is your radial pulse, and they're bilaterally symmetric. Next, I'm gonna do your brachial pulses. Okay, good. They're bilaterally symmetric. Next, I'm gonna check for strength. Have you pressed against my hands? Okay. Okay, very good. Next, we're gonna do range of motion. I'm gonna have you put your arms out, or put your arms to your side. Okay, lift them. Okay, that's abduction. Have you flex it? Good, that's flexion, extension, and then abduction. Very good. Next, I'm going to check your posterior thorax. I'm checking for any kyphosis or lordosis. I'm going to auscultate your lungs. Have you breathe in and out for me. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 11. Okay, very good. Now I'm going to check for respiratory excursion. Okay, have you breathe in and out. Okay, very good. It was symmetric. Okay, next, I'm going to have you lay down on the bed. Okay, have you take a deep breath in and out. Okay, good. It was contour and symmetric. Very good. Next, I'm going to auscultate in all 4 quadrants. I'm checking to see if your vowel sounds are either hyperactive, hypoactive, absent, or audible. I'm going to use the bell of my stethoscope. I'm going to start in the right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. Okay, your vowel sounds are audible. Next, I'm going to palpate in all 4 quadrants. Tell me if you have any pain or tenderness.
No.
Okay.
No.
No. Okay. Next, we're going to move to the lower extremities. I'm going to check your skin for any sores, lesions, any inconsistencies in your color, any edema, and everything looks good. So next, we're going to check your range of motion. I'm going to have you bend your knee, which is flexion. Okay, straighten it, extension, abduction, and adduction. Very good. Next, I'm going to take your socks off and check your pulses. Okay. Check your dorsalis pedis, which is bilaterally symmetric. Your posterior tibialis, which is bilaterally symmetric. Okay, next I'm going to check your capillary refill. Good, it blanks within 3 seconds. Okay, next I'm going to check your strength. I'm going to have you press against my hands. Okay, very good. Okay. We're finished with your physical assessment. I'm going to document it, and I appreciate you allowing me to perform your assessment today. You can go ahead and sit up. Okay, very good. Thank you so much.
Thank you.
Did you hit record this time?